ODD and challenging behaviours. Oppositional defiant disorder, ODD, and challenging behaviours describe patterns that affect daily life, relationships, and emotional well-being, rather than isolated moments of defiance. ODD involves ongoing angry, argumentative, or defiant behaviour. Challenging behaviours exist on a broad spectrum. Behaviours may increase during stress or change, often occur alongside autism, ADHD, anxiety, or trauma. Behaviour is understood as communication, not bad behaviour. Positive behaviour therapy instead of punishment. When behaviours escalate, punishment can feel like the only option, but research shows it often increases distress and conflict over time. Harsh responses can escalate power struggles. Fear or shame may reduce emotional safety. Punishment often misses underlying needs. Positive behaviour. Therapy focuses on understanding, not control. Children do better when they feel supported and capable. Boundaries can exist alongside empathy and warmth. Positive behaviour support, PBS. Positive behaviour support, PBS, is a respectful, evidence-based framework used across Australia to support people experiencing challenging behaviours. Positive behaviour support focuses on understanding why behaviour occurs, reduces triggers through environmental adjustments, teaches skills that replace challenging behaviours, supports dignity, participation, and quality of life, encourages collaboration across home, school, and community, aligns with NDIS principles of choice and control. Evidence-based therapies for ODD positive behaviour. Therapy works best when informed by evidence-based approaches tailored to each child and family. Parent management training supports consistent, calm responses. PBS builds skills across daily environments. Cognitive behaviour. Therapy supports emotional regulation. Emotion coaching helps children name and manage feelings. Combined approaches often lead to more sustainable outcomes. Support should reflect developmental stage and lived experience. Principles of positive behaviour. Therapy for ODD positive behaviour therapy is guided by principles that prioritise understanding, emotional safety, and skill development. Behaviour is understood before responding. Connection builds regulation and trust. Skills are taught, not assumed. Consistency creates predictability and safety. Small progress is meaningful and valued. Principles adapt across ages and support needs. Compassion strengthens long-term outcomes. Practical, positive behaviour. Strategies at home. At home. Positive behaviour strategies focus on connection, predictability, and emotional support rather than control. Use positive reinforcement for effort and progress. Give clear, calm instructions. Support emotions before correcting behaviour. Stay connected during distress with time and approaches. Involve children in problem solving when appropriate. Maintain predictable routines to reduce stress. Small changes can reduce ongoing conflict. Positive behaviour therapy for ODD focuses on understanding behaviour, building regulation skills, and reducing power struggles. PBS in school and early childhood school and early learning environments can increase stress, making consistent supportive strategies essential. Positive behaviour. Support can teach and reinforce clear routines and expectations. Use visual schedules to support transitions. Focus on encouragement rather than punishment. Develop individual behaviour. Support plans when needed, make reasonable adjustments aligned with disability needs. Teach emotional and social skills explicitly. Collaboration improves consistency and inclusion. When and how to seek professional help. Seeking professional support can be a helpful next step when behaviours are causing ongoing stress or impacting everyday life. Conflict feels frequent, intense, or overwhelming, even when you've been consistent and tried multiple strategies. Your child's participation at school or early learning is affected, or there are growing concerns about emotional or physical safety. Family stress, exhaustion, or burnout is increasing, and things don't feel sustainable at home. Early support helps reduce escalation, build understanding, and support long-term well-being without blame or judgment. How Affective Care supports you. At Affective Care, we understand that behaviour support is both practical and deeply emotional. Affective Care provides emotionally centred, person-first care PBS approaches focused on dignity and skill-building collaboration with families, schools and teams, respect for choice, culture and lived experience. Practical strategies that fit real life. Flexible support that evolves over time. Focus on safety, connection and empowerment. Ready to take the next step? You don't need certainty or a clear plan to reach out, just a willingness to be heard. At Affective Care, Conversations are calm, respectful, and always at your pace. There is no pressure to commit or decide anything straight away. We take the time to listen before offering guidance, prioritising emotional safety, dignity, and what feels right for you and your family. When you're ready, we're here to walk beside you.